Hi, this is Dr. Justin here, and thank you for subscribing to our video on the thyroid. In today's talk, we're going to be comparing the conventional treatments versus the more natural or functional medicine methods that are available. Did you know that over 90% of thyroid issues are actually autoimmune? Well, this is really important because conventional medicine tends to ignore this, and treatment does not change either way. Also, most doctors only run one, maybe two thyroid tests to assess your thyroid function. We're going to be going over at least 7 tests that you can run to assess your function, and also look at the thyroid holistically and figure out where the underlying drivers to your thyroid imbalance are coming from. For more information, feel free to visit justinhealth.com and or email or call the office. Thanks, and enjoy the show.
Hi, this is Dr. Justin Marchegiani here, and thanks for subscribing to our thyroid video report. And the goal of today's talk is really to go over the underlying imbalances that are driving thyroid dysfunction. And again, there are many different causes. We're also going to compare the conventional thyroid treatments versus a more functional or natural thyroid treatment as well. My goal for you is to walk away feeling really confident about the differences and to feel like you have some options moving forward, especially if you've already exhausted those options in a conventional setting. So moving forward here, your thyroid is a gland that sits right in your neck, right behind your Adam's apple. And your thyroid actually produces a couple of different hormones. So the cascade of hormones goes off like this. We have our pituitary gland in our brain, which produces thyroid stimulating hormone, known as TSH. This is what's conventionally read on your blood work, maybe from your MD. And usually if you're in a range between 0.5 and 4.5, you're considered normal. So we're looking at TSH, and then TSH then screams down to our thyroid to make hormone. And the main hormone we're testing is T4. Again, T4 is one of many hormones the thyroid produces. You also see T1, T2, T3, and calcitonin, but the main one we're testing for is T4. T4 then gets converted to T3 throughout the body, and T3 then binds to a thyroid receptor to cause a proteomic or an actual metabolic response. And again, if we're having hypothyroid or low thyroid function, again, we're going to be seeing fatigue, weight gain, coldness, depressed thinking, depression, constipation, thinning of the hair, dry skin, high cholesterol because our metabolism is decreased, so we cannot metabolize cholesterol into our hormones. And again, that then affects libido because libido is controlled by hormones as well. We also see a thinning of the outer third of the eyebrow and also poor digestion. So the driving underlying issues of thyroid imbalance, again, female hormones can affect thyroid issues, along with toxin exposure, blood sugar imbalances or dysglycemia, adrenal imbalances, and also gastrointestinal issues, whether it be parasite infections or even dysbiosis, which is an imbalance of bad bacteria in relation to good bacteria. So again here, to have a healthy thyroid response, we have a receptor site and we have thyroid hormone. And again, our active thyroid hormone is T3. So mostly what's prescribed on a pharmaceutical level is T4. But again, T4 has to get converted into T3 through a couple different processes. And that hormone then has to bind into the receptor site to cause a metabolic or proteomic response. So as you can see here, the baseball is like the thyroid hormone. It binds to the catcher's mitt, which is the receptor, and the spinning signifies a response, as you can see here. And the goal is we want that thyroid hormone to bind to the receptor with no problem so our metabolism can be healthy and we can feel good. Now, if we are having an unhealthy thyroid response, again, the receptor sites are being blocked. And what's causing the receptor site to be blocked? 90% of the time, it's an autoimmune issue. Research has proven that over 90% of all thyroid issues are actually due to an autoimmune etiology. So one of the things we see is Hashimoto's is very common. I actually have it myself. And what we do is we run specific lab tests looking at TPO antibodies or anti-thyroglobulin antibodies, and this is essentially looking at our immune system. Is our immune system making an immune response to our thyroid gland? And we can actually assess this. But what happens is the antibodies actually again block that receptor site so that thyroid hormone cannot bind in and create a response. And that's why giving thyroid hormone to a lot of these patients doesn't really help. The other thing is toxins. Toxins and heavy metals can also bind in and affect that receptor site. So there are a lot of things that are going on that a simple T4 medication really will not affect. Because again, T4 has to get converted into T3, and T3 is what's creating this response. So just because you're giving T4, you may have a whole bunch of conversion issues due to nutrition, due to stress, due to other imbalances. So we're not even going that far downstream. We're just looking at T3 binding, but again, T4 has to go through other steps to even get to the point where T3 is made. So again, let's summarize everything. So we have TSH produced by our pituitary. TSH then screams down to our thyroid gland to make T4. T4 is then converted into T3 throughout the body. But again, the majority where T4 is converted, T3 is in the liver. So if we're having toxin issues, we're not going to be able to convert our T4 to T3 optimally. We also see 20% of our T4 being converted to T3 in the intestines through specific enzymes, one known as sulfatase. And if we have a healthy gut bacteria, we're going to have optimal sulfatase enzyme exposure, and we're going to be able to help convert a lot of that hormone to T3. But again, many of us have had antibiotic exposure or eat too much refined sugar and junk in our diet. This throws us into what's called a dysbiosis, where we have more bad bacteria than good, and we're not going to have the healthy enzymes that allow for this conversion. And next, we also see 20% is inactivated into RT3. And this is usually due to stress or adrenal gland dysfunction. So again, eventually here, our thyroid responds by converting thyroid hormone T3 into reverse T3, which is essentially the brake. So it's another means, another protective mechanism the thyroid has to slow the body down. So reviewing everything here, we have inflammation, toxicity, and stress can affect the pituitary gland upstream. Again, we can have thyroid function issues via autoimmune, which is the majority of the etiology here. We showed the catcher's mitt and how the receptor site becomes blocked. Nutrient deficiencies. So again, T4 to T3 conversion actually needs certain nutrients, one being selenium, for instance. Selenium is really important. Even magnesium and zinc. These are nutrients that are really important for allowing this conversion to take place. Next is progesterone. So if we're in a stress response, it's easy to find many women in a state of estrogen dominance where they essentially have higher amounts of estrogen in relation to the normal 25-to-1 progesterone ratio. So we start to see that progesterone ratio start to decrease and estrogen start to increase. And again, thyroid activation is decreased because of toxicity, digestive problems, inflammation, and like we talked about before, the estrogen dominance that we see in the past. So again, detoxification, really so important in this functional medicine paradigm, because we see here 100% of people in certain EPA studies were shown to have these PCBs or these dichlorobenzene or xylene. These are all nasty chemicals, and they are prolific in today's society, and they have direct effect on our thyroid. So detoxification is really important. And after seeing the slide previously, it's shown that 60% of thyroid hormones converted from T4 to T3 in the liver. So if our liver is too busy dealing with these toxins, it's going to be really hard to activate thyroid hormone normally. And as you can see, these toxins are all around us, especially if we're eating conventional produce and not eating organic. We're going to have a big exposure from these sources. And as you can see here, thyroid function and its effect on reproduction via these organochlorine pesticides. And again, right here as well, via thyroid function in pesticides. So if you're not eating organic, you're going to be getting a big dose of chemicals that will be affecting your thyroid in a negative way. And again, right here, PBDEs, which are polybrominated diphenyl ethers. These are also organic chlorines and can derange transportation of thyroid hormones. So just more ways our thyroid can get messed up. And also PBDTEs, these are also flame retardants in mattresses, and these also block the receptor site for thyroid. So if you have a new mattress or if you're a newborn on a new mattress, these mattresses have flame retardants that have compounds in it that can affect your thyroid as well. We also see it in our personal care products, whether it be phthalates or the other compounds mentioned. These are all prevalent in all of our female or even our hygienic products. I mean, I mentioned female because females wear makeup and a lot more hygienic products than men do, but we're still getting exposed from soaps and aftershaves and deodorants and not just makeup, etc. So as you can see, limiting the exposure via having healthy hair products and healthy body products will do a great deal of good for our thyroid. So again, dysglycemia is a huge thing in how it affects thyroid function. So if we're eating poorly, our blood sugar goes on this nice little roller coaster ride that you see here. We make a whole bunch of insulin at the top, and then we make a whole bunch of cortisol and adrenaline at the bottom to help bring our blood sugar back up. So again, blood sugar on the left, time on the right. And as we continue to go on this roller coaster ride, our body actually makes this interleukin called IL-6. And this exacerbates essentially autoimmune conditions. So 90% of us have autoimmune thyroids if we have a thyroid issue. So making more of this interleukin 6 because our blood sugar is unstable is going to cause more thyroid destruction and is going to affect our thyroid from expressing optimal health. And as you can see here, when our blood sugar is in that perfect zone, we have stability, we're eating every 3 to 5 hours, we're feeling good. This allows our metabolism to be optimal, and we know our thyroid is the center for our metabolism. So female hormones play an important part. So as you can see, we have estrogen in the first half of our cycle, and then we have progesterone predominate in the second half of the cycle. When we get stressed, what happens is our progesterone falls out. And as you can see here, progesterone gets converted into cortisol. That's why that's happening. And progesterone is really important for thyroid hormone activation. It helps stimulate this enzyme called TPO, which allows our thyroid to make more thyroid hormone naturally. So again, if you want more elaboration on this, feel free and check out our female hormone report where we spend a good 15 minutes going over the female hormone imbalances, and you're going to see a lot of overlap if you watch both videos, but strongly subscribe to the female hormone report as well. So as you can see here, this is our HPA axis and our HPT axis. So we have our hypothalamic pituitary adrenal axis and our hypothalamic pituitary thyroid axis. And as you can see here, we have our brain, which signifies our pituitary, and we have our adrenal and thyroid. And what happens is we have specific feedback loops. I consider them like a thermostat. So consider your thermostat, let's say, is set at 70 degrees. If we start going higher than 70, 71, 72, the air conditioning turns on, and if it starts dropping too low, again, the heat turns on. So our thermostat essentially regulates these feedback loops. We make various releasing hormones that go down to our glands. So in the example of our brain to our thyroid, we're making TSH, and we make various hormones or feedback loops going back up that keep us in regulation. And what happens, our adrenals here make sex hormones, DHEA, progesterone, estrogen, and we also make cortisol. Our thyroid then makes T4, which then gets converted into T3. And healthy adrenal balance, healthy cortisol balance actually helps with T4 and T3 conversion. So if our cortisol actually goes too high, we're not going to be able to convert T4 to T3 optimally. And if our cortisol goes too low because of adrenal fatigue, we're going to actually have the same problem. So we need a healthy cortisol balance to have optimal expression from T4 to T3. And these are our common stressors. It could be estrogen toxins, blood sugar issues like the last slide just depicted, infections, emotional issues, heavy metals. It's been shown that H. pylori is a nasty infection that can affect the thyroid, along with Yersinia and even Epstein-Barr virus. So these are all infections that can affect our thyroid function. So when we're stressed, you can see it being depicted by the shaking of the words here, we are actually going to lose feedback loop control. So you see that with the lightning bolt hitting the thermostat, we're not going to have optimal feedback loop from the gland back to the brain. And this is going to affect our ability to make healthy sex hormones, which throws us into sex hormone balance. We're making maybe too much or too little cortisol, which then throws off our thyroid conversion, and we start actually making more reverse T3, which is our natural brake on our thyroid hormone. So this is where we start seeing symptoms, energy issues, fatigue, depression, constipation, thinning of the hair. These are our main thyroid hormone presentations that we're going to see right here. And again, the underlying solution really is to pull off the stressors and to get the feedback loops back going again. So we're here, but the goal really is to address the stress so we can get the feedback loops and get optimal hormone conversion happening again. So again, if we're having gut issues, whether it's inflammation in the gut because we're eating certain foods that are causing inflammation in our villi, like gluten or grains, or whether we have bacterial overgrowth in the gut, which is creating endotoxin. Endotoxin is the outer layer of the bacteria in our gut, and that can actually cause a lot of irritation and affect our body's ability to absorb nutrition. And again, like we said earlier, 20% of our thyroid hormones actually converted with healthy gut bacteria. So without healthy gut bacteria, we're not going to be able to get our thyroid hormone into optimal levels. And again, if we have parasite infections too, this can also cause that whole stress cycle to continue to repeat itself. As you can see here, stress can be bacteria, food allergens, various infections, and the goal really is to remove that stressor. So again, saying it in a different way, we have our hormonal pools, the raw material for all of our hormones. It can either go in one of two directions. We can make stress hormones or anti-aging or building hormones. The goal is we have a healthy balance, but when we're stressed, we start making more of our stress hormones, which throws off our thyroid hormones as well as our female hormones. But the goal really is to pull the stressor away and to put ourselves back in a favorable balance where we're making more anti-aging hormones, healthy thyroid, healthy testosterone, progesterone, and estrogen, and less cortisol. Again, lab tests. This is always a question I see. Conventional medicine typically only runs TSH. And again, here your lab ranges 0.45 to 4.5. That's actually come down recently of late. And then we look at T4. So these are our main two tests we run. And again, the actual, I very rarely even see T4. Most of the time I only see TSH. And again, if we see TSH elevate over 4.5, that's a sign of hypothyroid because the brain's trying to scream louder. It's making more TSH to get thyroid revved up. And if our TSH drops, it's a sign the brain's saying, hey, it's trying to be very quiet and almost whisper to the thyroid because it's already making so much. And again, T4 and TSH are primarily only run because it's a pharmaceutical drug-based model. They're only running those tests so they can prescribe a drug. And one of the most popular drugs is synthroid or levothyroxine. And when you give that medication, you actually see changes in these lab tests. And it's possible for these lab tests to actually look normal but still have thyroid symptoms because we're not addressing the other autoimmunity, the toxins, and or T3. But when we run a full panel like you see here below with T3 uptake can be affected if you have high testosterone or if you're taking birth control pills. That can actually decrease T3 uptake. Looking at T3, our free T3 and our regular T3 here, we can actually get a look at how our body's actually converting thyroid hormone T4 into T3. And as also looking at our antibodies. Are you autoimmune? And again, looking at our reverse T3, which is the brake. So when our body becomes stressed, we convert more of that thyroid to reverse T3. So as you can see, when we compare the conventional assessment versus the functional medicine or natural assessment, it's much more comprehensive and is pulling in many more factors that conventional medicine is even considering. And we even have specific functional ranges that we are looking at. So functional range is nothing more than a strict or more fine-tuned range that we consider a healthy person to have. So when we have our conventional laboratory ranges, 95% of the population essentially has to fit in this range. So we know 95% of the population isn't healthy. I mean, if you look around and see your friends and family, only a smaller percentage is. So we want a more fine-tuned range, a narrower range, so we can see, hey, this is where you want to be if you really want to be healthy. And then every bit off of that, we can kind of look at as shades of gray. So we want to have optimal reference range so we have a goal to get our patients to work into, and also as a means to see how far off they are. So action items here today. We went over a lot of information, of course. But again, get your thyroid hormones assessed. It's really important. TSH and T4 is not going to do too much for you. You have to get assessed. Do you have an autoimmune thyroid in nature? How's your body absorbing thyroid hormone? How's the conversion from T4 to T3? Getting your adrenals actually checked is really important because we know how important cortisol, healthy cortisol levels are for T4 to T3 exposure. And also female hormone imbalances can drive imbalance in thyroid response as well. So after going over everything, you can see how a TSH and a simple T4 is incredibly inadequate at assessing your thyroid. Again, evaluate where stress is coming from. Again, we keep our stress in three main areas, physical, chemical, and emotional, whether it be on the chemical side with foods and toxins and infections, or whether it be on the physical side with too much or too little exercise or chronic injuries, or on the emotional side, which is potentially job issues, work issues, relationship issues. All of these can drive stress, so you have to hire someone or essentially see someone who's a good stress detective that can figure out where the most important priorities to work on for stress is for you. And again, go to justinhealth.com and click on the Become a Patient button. Again, you will get the initial paperwork sent to you. This contains a metabolic assessment survey which you can fill out, and we can always get you scheduled for a 15-minute complimentary, no obligation consult to at least discuss what your options are. Most patients get 3 to 5 minutes with their doctor. Again, they're running the TSH and the T4, which is incredibly inadequate. Right now, I'm giving you guys the ability to actually get your questions answered and to see what the next step for you may be, what the best next step is. And again, you're only one decision away from getting your health back. Really, it just takes one decision to get back on track, making dietary changes, running the right lab tests, doing a couple of things that are going to really make a big difference along the way. Well, I hope you found this thyroid report informative. And feel free and visit justinhealth.com and or email or call the office. Thanks. Have a great day.